Good morning, good afternoon, good evening, and all of you who are joining us from India. Happy Makar Sankranti, Uttarayan, and Gudi Padwa. And Pongal, of course. Today, in the day where we have so many festivals, and we would like to remember a little bit about what happened in the last 2 years and how we got here at a place where life has now become a little more different than it was these many years ago. Today, when we are celebrating, we also remember that we went through as a country a major crisis and came out fighting from it. And all of us who have been in the business of healthcare, who have been in the industry of healthcare, delivering it to several different modes, industry, and channels, would love to understand how we can better it going forward. And on that note, we had this webinar series to understand problems with us. Mr. Bharat Gera is the founder of human-centric healthcare ecosystem. So when the first time when I spoke to Mr. Gera, uh, he explained to me and I asked him what really is human-centric healthcare ecosystem. And he said that healthcare has been a little, um, you know, information asymmetric. And we are not really patient centric anymore. And he has been working diligently to try and correct that little bit of a tweak. Not only has he been, a master in finance from NMIMS and a veteran from the Wilson College, but he's also worked for several years in the financial areas. And then since 2014, he worked with KMG Infotech in Health IT, with Dr. Ramesh Hospitals as the CIO, and then later as a strategic advisor to several different startups, including Geo, including Dog, including Kim's Hospital as well. So with these many years of extensive experience and his amazing work during healthcare, in healthcare during COVID, I would love to invite Mr. Bharat Gera to grace us with his presence, even on a festival day. Thank you, Bharat.
Thank you. Wish you all a happy Makar Sankranti or Pongal or Lodi or whatever you're celebrating.
Uttarayan for me here, but thank you so much for it. So, Bharat, first of all, thank you so much for coming in. I would really want to understand, actually, let's start with that. You have been working recently and strongly on human-centric healthcare. What, in your perspective, is human-centric healthcare and why do we really need
it? You kind of mentioned it earlier that the care in healthcare is missing. And the care has to come from human beings, right? And while we're seeing a lot of advances in what is possible with digital technology, there needs to be a shift in mindset where empathy is also given the due importance. So when we look at things from a human-centric point of view, we look at how to fulfill a human need first. And then we look at how to bring in a change in process or a technology, rather than the other way around of bringing in the technology first and then looking at what human need it solves. So let's take an example. For example, if you're looking at preventive care for diabetes, right? What's really important is to understand the whole human goals of that person who is now faced with this prospect of living a life with diabetes, right? How old are their kids? How financially secure are they? What is their family socioeconomic setting in terms of the family relationships and so on? So we need to understand the emotional, social context in which they're living their lives, and then suggest what will be a good way for them to stop the progression of the disease. Unless we understand their whole life, we giving them an advice, for example, that you must go for to at least half an hour of brisk walks every day. And suppose they live in Vikhroli in Bombay, where I was recently, where if you step out for a walk, you're going to get worse. You're going to probably end up with pneumonia. So I think you need to look at the context of that human being and their needs, and then suggest what might be the right approach for them. Is it medicine? Is it exercise? It is nutrition, or is it just stress? So
Mm,
personalizing healthcare depends a lot on understanding the human side of things. And I don't call it patient centric because there is the other side as well. That if you look at a
mhm,
lot of preventive care in India is done by ASHA workers, right?
mhm.
For a large population and
Okay.
millions of these workers, right? Now, when we look at new ways of solving problems, we say, okay, we'll use all these point of care devices and these new kinds of equipment and AI and so on. But we don't look at how this ASHA worker is going to feel doing all these activities. It's not like this ASHA worker is a sort of a vehicle for these technologies to be reaching the last mile. What we have to recognize is that what really works in the ASHA workers is their ability to deliver certain services for preventive and for immunization and so on. But it's also very important that what is the relationship that they have with their community, and we have to keep that relationship in mind, and it should not take away when we bring in a new technology or new method. It should not take away from that relationship, because if
Mm,
they become too dependent on somebody remote, they lose
mhm.
that bond they have with the community there. So that's what I meant. We take into account the emotional and social context when designing any solution, and that is the human centric approach to healthcare.
No, that makes a lot of sense. Without human centric approach, perhaps, and maybe this is going back to the basics, right? We
Yep.
used to have a very human centric approach to healthcare. I think, characters. I do remember this reading about Dr. John. I think Dr. John Brown, who was the inspiration for Sherlock Holmes. So he used to be
Hmm.
able to diagnose people without really even going into details, just by observation. So that was the keen level of human interest that they took into understanding human behavior, into understanding situational and this thing. And they did not really quantify each and every aspect of it. So I think that there's a huge push towards it. But maybe later we would love to even understand on a separate session as to how human centric care in today's world of capitalistic approach to or industry approach to healthcare works. How does that set in the for profit mindset, right? Just
I
to
Yeah, sure. No, I don't think it has any conflict with the profit mindset. It's just that the nature of providing healthcare services is
Mhm.
being impacted by various forces, which includes the need for monetization. After all, the doctor has to make a living, the hospital has to make a living, and so on. This It's not about empathy. Is not about being you know necessarily like a charitable organization. Even charitable organizations that I worked with, they need to generate enough funds to sustain themselves, right? So I don't think there's a conflict there. But the point about human centricity is that you need to know what is more effective, and if you're more effective, you'll be more profitable. I'll give you an
Mhm.
example. Increasingly, what I'm hearing both in the US and in other geographies as well as India is one phenomenon which is very interesting. And I've been asking people, what is their reaction to it? And the phenomenon is that a lot of people are, um, you know, engaging with healthcare coaches. Now, these
Mm-hmm.
healthcare coaches, aided with some technology, with digital health technology. Now,
Mm-hmm.
the healthcare coaches are not doctors,
Mm-hmm.
but they are able to bring fairly improved outcomes. They are able to show outcomes in terms of improvement in the patient's condition. Of course, there's a debate about how scientific their studies are.
Mm-hmm.
But in anecdotes, you hear a lot of people very happy with that experience. And I think the secret there is the same thing, that the human coach is able to engage and understand that person's social context and emotional context, and then make them do things which make them feel better. Now, whether that is actually clinically better or not is debatable,
Mm-hmm.
but they're definitely, becoming very popular and sometimes being preferred over clinicians. And I think my point really is about human centricity in healthcare is that even the clinicians should, uh, as you said, like the doctor in Sherlock Holmes, or the doctors in the past, like William Osler, who was the father of modern medicine in some ways, right? Um,
Yes.
Medical education, at least. And
Mm-hmm.
if you read Oslerisms, they're all about human centricity.
Yeah. No,
If
I
you read
think
Hostler statements, their quotes, they're all about human centricity.
no, I completely agree with you. So, I mean, because you did mention about health coaches, and 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 you are a veteran in finance and a gold standard in understanding technology for healthcare, at least from my perspective. I really wanted to understand, what is happening right now in the industry. We have all heard and extensively spoken about Chat GPT, right? And how interesting it is that OpenAI has created a vehicle which is so interactive, fun to be with. And we have always, I think, with IBM Watson, with Babylon, time and time again, we have discussed about the possibility of autonomous diagnosis and new technology, AI based solutions entering and hopefully helping out with the dearth of qualified healthcare professionals that we have globally almost always. So, where do you see new technologies playing a part in health tech? And do you think, Chat GPT might one day be able to diagnose diseases as well with the same kind of understanding?
It's very interesting that everybody is talking about Chat GPT,
Yeah.
um, and it is often talked about as something that is revolutionary. Uh, and
Yeah.
it was out of the back door almost that it's come out. Of
Yeah.
course, some people had the vision, like Satya Nadella and so on, who
Mm,
put the force behind it,
of
and
course.
of course the OpenAI group. Uh, but notice one thing there, the fact that ChatGPT works so well has a lot to do, of course, with the language model and the AI, but it also has to do with the way it engages with the human being.
Mm,
It goes back to what a lot of people in AI circles were questioning. We
mm.
had Turing who had developed the Turing test, right?
Yeah.
And a lot of people in AI at one point were like, I remember in one of the events where I brought up the Turing test, it was like, that's old hat. Nobody wants a machine to be able to do a human-like conversation with you.
Yeah.
That's not true. Emotionally, people do like a machine
Yeah.
that does human-like conversation, and that's why it's very popular. Uh, Now the challenge will be GPT-4 and beyond, right? And I think there are, once you've worked out the front end, once you've got the engagement, then you need to have technology which has other dimensions, like image, which is already there, like image analysis, um, and a lot of other AI technologies which are using various biomarkers, using voice signals, and everything in your body is sending out some kind of signal. I mean, if you have a dog, you know that they're very, very sensitive to various things that are happening to you. They're the best sensors out there. I think if somebody can invent a smell sensor, the kind of the way dogs sense disease, and I believe they're very good at sensing diseases. So we can technology of various capabilities in terms of sensors, IoT devices, IoT devices, and the use of various AI techniques beyond what is being used right now. From image classification to using more how to. One interesting thing would be how to use behavior change therapies and be able to predict what kind of interactions should ChatGPT have with the uh, person who needs behavior modification, and
Yeah,
training a
I mean,
ChatGPT robot to do that.
yeah, I think
The
a
possibilities
lot
are
of things.
immense and unending. Yeah.
I mean, I would love to see and understand how solutions like those can actually be, as you mentioned, Turing test. Yeah, human like is one thing, but the kind of cognitive intelligence that we would require for something like a primary care diagnosis would be immense. And I still see that there are, challenges in getting the right kind of data, but I think that we are well on our way to doing it. Maybe someday soon. What do you say?
So I was reading some article about it, and I've spoken to doctors who are working in primary care. Um, uh, and one of the things is, yes, there will be fairly big degree of error. Some people quoted a figure 16.5% error in terms of primary care diagnosis, right? I read somewhere about that. Um, the point is, it's not going to be a definitive diagnosis. It's going to be a differential diagnosis. So it cuts down
DDX.
a fair amount of the work, right?
Of course
Uh,
it does.
yeah, so it
I
cuts
mean,
down a lot of work, and smart doctors will use it to cut down their
mm,
workload. I would imagine. Just like
yeah,
smart content writers will use it to cut down the effort that it takes
yeah.
them to put together the content.
No,
But if they
I
just cut
have
and paste, then
people.
they don't get good content, right? So yeah.
No, I have people who have had ChatGPT compose poems for them. So interesting things
Oh
are
yeah,
happening out
sure, sure. That's I think that's again the fascination bit, and they've been clever about doing
there.
that because they
Yeah.
knew wherever that you can evoke emotions, they've used the
Yeah.
emotional levers a lot. So that's been very
Yeah,
clever.
and it's it's been pretty interesting. But because you mentioned doctors and doctors using technology, and you have worked with so many healthcare systems in your career in healthcare and health tech, what do you feel about clinicians and their acceptance of technology per se? And you know, I personally have faced some issues going into that space. So, what are the best ways to move in those areas? Because essentially, what you were saying was a CDSS use, a clinical decision support system use for areas like this. But those kind of use cases are not very well accepted per se. At least that's been my experience. What's been yours?
I think the new terminology is not to call it CDSS because it kind of relates to the old EMR world where you put in something
Okay.
and then you get a decision support. I think a lot of people have switched to calling it, virtual assistant for a clinician.
Okay.
And just one second. Yeah, sorry. So some people have, as I was saying, virtual assistant is probably a better term. Now,
Hmm.
about digital literacy of clinicians, um, it varies. It is level one in some cases where they've struggled to use any kind of technology, and there are, and I'm talking about information technology. They use medical devices. They use all kinds of things, but using computers or phones, even some of them are not that comfortable. Although almost everybody is comfortable using a smartphone these days. But I've been studying this topic. I was requested to look at the possibility of doing a survey on digital literacy for Indian hospitals. And
Hmm.
I've been looking at the subject. So there are frameworks for digital literacy, and including the Skills for Information Age framework and the NHS UK framework for digital literacy, which have interesting ways to assess digital literacy. So it's not just about being, some people say just, oh, but everybody's smartphone savvy these days. So that means they know how to use technology. That's not correct. I think there are 6 dimensions of digital literacy, one of which is ability to communicate using technology. Another is how to analyze data, the ability to use data analysis, the ability to do research. So it's basically about, how you can use technology to enhance your capabilities at work. And that may not be the same savviness we associate with, as a consumer. So I think it's a mistake when some people say, hey, no, all my nurses are, mobile phone savvy nowadays. But that doesn't mean they know how to critically look at a remote device and know when it is not, working properly, and how to interpret those errors or the margin of errors that happen. Uh, you know, that's something which requires how to look at data, how to understand the capabilities of that sensor. Those are work-related capabilities, and they need to know those topics. And when somebody says specificity of 89%, what does it mean? So those things are not necessarily understood well enough at consumer level. And when we say digital literacy, it should be about not just the ability to use computers and phones for consumer use, but it should be about being able to use them for work. And it comes down to simple things. I mean, how good are you at Excel or any analytic, analysis tool, Power BI or whatever? Can you configure your system to be able to, pick data from a different data source, and you know what an API means. I think
Yeah.
those kind of literacies are the ones which are required for work. And in that, the clinicians that have that capability, because they're not taught it in college, is low, and they need to improve that, and it should be introduced as part of medical education as one of the subjects, so that they have some grounding on how to use technology in the workplace. Right. Of course, there are exceptions, and there are clinicians who can write their own Python code. I knew one, and I know a few who can do APIs. So there are all kinds of people, of course. Clinicians are generally smart people, so if they have to learn something, they'll learn it very fast.
No, of course. After you working with doctors for so long, if you say that, I'll take that as a compliment. Because for sure, I think that use showing them the use case from student life onwards, that could make a huge difference in understanding how to adopt to tech better.
I think that's essential. Yeah.
Yeah. I also wanted to understand when it comes to healthcare, what are both the major challenges as well as the future trends? We have been looking at technology rising and falling in the current times. Crypto rose to, um, not multi, I think around tens of $1 trillion worth of market capture, and then collapsed for a bit. Then we had NFTs rise like nobody's business. Everyone was talking about that, and then again that collapsed. So we have seen, really creative technology that most people, even me, we don't completely understand, rise and fall, and be part of the financial market and the and the vernacular of current times in a big way. How do you see, you know, that in any way taking healthcare forward? And if not, and if so, what would be the major challenges of adopting some of these technologies?
So recently, I happened to be lucky to attend a session where uh, a Korean hospital was demonstrating the use of metaverse. And they were showing their hospital on a metaverse. So the use case was that you don't have to go and visit that hospital physically, nor do you need to arrange a Zoom call like the one we have. But you could just walk into the hospital, and just like you would do in a normal physical scenario, was wait outside, and the doctor would call you in. So you're not setting up a Zoom call or a session or anything, right? And you would actually feel you went to the hospital. So, it kind of gives you that sense because you would be in that room where the doctor is sitting and actually seeing physical patients, and physically the doctor is actually there as well. So it's interesting. It was a little bit like a game, uh,
Mm.
but it's not there yet. I mean, there's a
Mm-hmm.
long way before the metaverse becomes real, uh,
Not yet.
where you're really virtually there, where you can, sense that person there, and or if you want to call it a digital twin is created, and I mean he called it a digital twin, but a digital twin means my body temperature in the digital twin should be the same as the
Yeah.
body temperature there. So I think there's a way to
Very.
go in using it in healthcare.
Yeah.
But there are cutting edge technologies which have here and now use cases in healthcare. I think we are in AR very useful in education
Mm.
for doctors, to do simulation labs, and for nurses and
Mm.
technicians to learn how to carry out various procedures. I think very cost effective.
Mm.
Otherwise, the ladle and all these mannequins and all are very expensive, can't be reached to the last mile. So we
Mm.
were recently interacting with one of the trusts, which is working with a number of PHCs, and they
Mhm.
want to train all their last mile workers on
Yes.
using VR and AR. And I think they're
Yeah.
very serious about it. So I think people see the potential for these
Mhm.
cutting edge technologies in certain areas. And
Yeah.
VR and AR also has proven to be useful in therapeutic, especially in physiotherapy.
Of course.
Yeah,
I actually, you know, first of all, your insights are really keen, and I would love to discuss it later with you more about, digging deeper into some of these technical applications in healthcare. Uh, Thank you for your time today on Makar
welcome.
Sankranti again, Bharat. And I'm truly grateful to have you here. But before we leave, I just wanted to touch upon just one small thing before that. What are your thoughts about Omnics and genomics away sweeping the diagnostic and even the therapeutic markets? What are your thoughts about that? Do you think it's a next big thing? Do you think that targeted medication is the name of the game going forward?
Totally. I think genomics is becoming cheaper, much, much cheaper than it was. I think there are some figures quoted that Illumina's abilities come down to bringing down the cost to $200, whereas it was thousands of dollars and then
Yeah.
hundreds of thousands of dollars before. So the fact that it's becoming extremely economical, um, it's absolutely sensible and makes perfect sense to uh, be able to do a lot more of genome sequencing, which means that a lot of secrets will come out in terms of how how to be able to predict onsets of diseases or the vulnerability to certain diseases. So I think definitely there's a huge potential and huge applicability. Um, the only thing one should be careful is one should not just because it's become cost effective and just because it has become easily available, it should not be misused. And that's where again I think the human side makes a difference, that it should not be misused for uh, diagnosing things and predicting things which may or may not happen. Like we know, you may have a gene for breast cancer, but it may not express itself during the course of your life. And using genomics to put that fear in your life and make you go through a life full of fear, where you are going to be, always thinking about, your whatever percentage chance of getting breast cancer, which is not a good idea. I think that direct kind of prediction is not a good idea. It should be used in combination with a lot of other disciplines. and people talk about the upstream disciplines like proteomics and so on, but also just clinical observations and so on. So it should not be used in isolation and should not be misused. It should not be misused by patients also, because patients also sometimes, and I would be one of them happily, I didn't do anything wrong in my life. I didn't, have too much alcohol. It was just my genes, which led to
Yeah.
XYZ disease. That's
No,
not
no.
correct. We should not, use genetics as an excuse to be lazy and not take care of our
No.
health. Yeah, so there can
No,
be
we,
potential misuses of this freely available
I,
data. Yeah.
no, I think you were correct about the overuse of it as well as, and we need to understand that just because it's a cheaper resource now doesn't mean its application is everywhere.
Yeah.
And we also need to understand and analyze the reports specifically, as you quite rightly mentioned. Just because you are BRCA positive or you have some different, some concentration of a BRCA gene does not mean you're going to have breast cancer. So, you anyway would go for a mammography after 30. So, does it really, how much of a difference does it make is something we should cleanly look into, I think. And this happened to me very recently. I was speaking to a very serious investor and policymaker, and they said, we would love to do what your case did. We would love to make an entire gene sequencing network for India, where we create genetic sequences for everyone. And I said, my God, this is, I am a big fan of House MD. And I think I learned more medicine there than I did in medical school. But no, that's not true. I adore my professors, but still. But I remember there's this one thing that you never give full body scans, full body MRI scans, because you'll always find something or the other off. And then that is what you will start focusing on instead of what your body is trying to tell you with the symptoms. So that kind of imprinted my brain, and that is the philosophy I think has extended now to my understanding of genetics as well. That first you need to follow what your body is trying to tell you, because sometimes it's more intelligent than you, than all the diagnostics, techniques on the earth put together. So
Totally. What your body is telling and what your dog is telling you.
yeah,
Both.
completely agree. Okay. Thank you so much, Bharat. It's been an honor and a pleasure always to learn from you and to speak with you. And I hope we continue this tradition going forward as well. Thank you for your
Thank you,
time
Dr.
today.
Savin. Thank you so much. Enjoyed the conversation. Thank you.
Take care. Bye bye.
Bye.